Okay, let's dive in. Today, we're exploring a really interesting intersection, technology and healthcare.
Yeah, and specifically, how artificial intelligence is being used to figure out what you, the patient, are actually saying about the care you receive.
Exactly. All those comments, the reviews, the feedback forms.
Right. Think about it. Every survey you fill out, every online review, maybe even a comment on social media about a hospital or a clinic visit, that's all feedback. But, well, the amount of it is just huge.
We're overwhelming, I'd imagine.
Totally. So our mission here in this deep dive is really to unpack how AI specifically, this technique called sentiment analysis, can sift through that mountain of, unstructured text.
The actual words people use.
Yeah, their words, and turn it into something concrete. Actionable insights that healthcare organizations can use to genuinely improve the quality of care.
And we've got some source material to guide us here. We're pulling from research on AI ethics in healthcare, studies looking at how patients actually feel about AI.
Their perspectives.
It's an abstract from NYU London about using AI for feedback, and also a resource that kind of breaks down sentiment analysis itself.
So it's not just theory. We're looking at the practical side and, importantly, the ethical guardrails that need to be there. It's about how organizations can actually listen effectively at scale.
And the responsibilities that come with that power. Okay, so kicking things off, patient feedback. We know what it is to give it, but what is sentiment analysis in this specific healthcare context based on our sources?
Okay, so at its core, like that numerous.ai source describes it, sentiment analysis uses natural language processing that's a branch of AI.
NLP. Yeah.
NLP. Uses that to figure out the underlying feeling, the tone, the opinion within a piece of text. Is it positive, negative, neutral? And maybe even how positive or negative it is.
So it's more than just counting keywords like good or bad.
Oh, definitely.
Yeah.
It's trying to grasp the sentiment, the feeling behind the words. So someone writes, like you mentioned earlier, the nurse was fine, but I waited 2 hours even though I had an appointment. The AI wouldn't just see nurse and waited. It would hopefully understand that waited for 2 hours carries a negative sentiment, frustration maybe, and connect that feeling specifically to the waiting time part of the visit.
I see. It's extracting that subjective stuff, opinions, emotions, attitudes.
Exactly. The numerous.ai source really stresses that its main job in healthcare is to get valuable insights into what patients prefer, how they behave, by analyzing all this content, moving beyond just, ticking boxes on a survey.
Right. Getting into the narrative, the story patients are telling. Okay, that makes sense. You get much richer detail. But how does knowing the feeling help an organization actually do something? What are the practical ways this analysis turns into action?
Right. This is where it gets really interesting and, frankly, useful. One big application mentioned in that numerous.ai material is analyzing specific aspects of care.
Okay, what does that mean? Specific aspects?
Well, instead of just getting a general satisfaction score, which could be pretty vague sentiment analysis, let's organizations break down the feedback. They can segment it.
Segment it
by different parts of the experience. So the AI can look at reviews and tell you the sentiment specifically about, say, how well the doctor communicated, or how easy it was to schedule, the waiting room time, how clear the discharge instructions were, was the place clean, even the food sometimes.
So it's like dissecting the whole visit into its parts and seeing how patients felt about each one?
Exactly that. And that level of detail, that granularity, is gold for quality improvement. Just knowing satisfaction is down doesn't tell you where to start.
Right. Not very actionable.
But knowing that, say, 60% of the negative comments last month were specifically about waiting times in radiology or difficulty using the online portal, that gives them a clear target.
Okay, yeah, that makes sense.
It helps pinpoint exactly where the friction is, where to focus resources and effort to actually improve the patient's experience. Turns those vague grumbles into solvable problems.
You also mentioned online reviews and social media earlier. That sounds like trying to drink from a fire hose.
Okay.
How does AI handle that volume?
That's the second big application they highlighted. Monitoring online reviews and social media at scale. AI can be set up to automatically gather feedback from public places like Google reviews, Yelp, Twitter, Facebook.
So they're not just waiting for someone to fill out their official survey. They're actively scanning.
Exactly. Actively listening to the digital conversation. And the sentiment analysis part processes that continuous stream of data.
What does that allow them to do?
Well, it lets them spot emerging trends in what people are saying, almost in real time. Are complaints about parking suddenly spiking? Is there negative buzz about a new policy?
So identifying issues quickly.
Yes, and responding quickly, too. If they spot negative comments on public forums fast, the organization can step in, address the issue, offer help, maybe provide clarification. That's huge for managing their reputation and, proactively building trust. It shifts them from just passively collecting feedback to actively engaging with it.
That feels like a big shift, from reactive surveys to this more proactive monitoring and response. Okay, so we see how AI can dig through feedback, find the specific pain points. How does this fit into the sort of bigger picture of AI transforming healthcare overall?
Yeah, let's zoom out a bit. That HAIT book introduction we looked at really positions AI as this, fundamental force changing healthcare. It talks about AI's potential to streamline things like administrative tasks,
Cutting down on paperwork.
hopefully, and also augmenting what clinicians can do, giving them smarter tools. And the ultimate goal is improving patient outcomes and making the whole system more efficient.
So it's not just a fancy feedback tool. It's part of this wider effort to make healthcare work better.
Absolutely. And analyzing patient feedback using sentiment analysis feeds directly into improving efficiency and outcomes by identifying those friction points in the patient journey. And as we mentioned, this relies heavily on natural language processing, NLP.
Right.
The HAIT book specifically calls out NLP as key for handling unstructured text data, which is exactly what patient comments are. Healthcare AI uses a whole range of techniques, from simpler rule-based systems to really complex machine learning and large language models. But for understanding the nuances of human language and feedback, NLP is essential.
And that NYU Langone abstract title, Artificial Intelligence Feedback on Physician Notes Improves Patient Care. Even without digging into the study itself, it illustrates the point, doesn't it? AI looking at text, in that case doctor's notes, providing feedback to improve care.
Exactly. Sentiment analysis on patient feedback is doing something similar, applying AI to a different kind of text, patient comments, to improve the experience of care.
It's AI generating actionable insights from complex data, whether it's clinical notes or patient reviews. Okay, the potential seems really clear. Sifting through massive amounts of data, identifying specifics, enabling faster responses. But we are talking about people's health experiences, sensitive data. This leads us straight into the ethical side of things.
Yeah, this is absolutely crucial. The ethical considerations review and the patient perspective study we looked at really drive this home.
Right. This is where the rubber meets the road, ethically speaking.
Definitely. Using AI in healthcare, especially with patient data, throws up some big ethical challenges. Both those sources hammer this point.
Patient trust seems like the foundation. The patient perspective source talked a lot about that.
It did. And it highlights this tension. AI offers amazing analytical power, right? But building trust with these complex systems, which often aren't very transparent, that's tough.
People don't trust what they don't understand.
Exactly. That study found, interestingly, that even if an AI is super accurate, patients still really value human judgment. They value that empathetic connection with their doctor or nurse.
So AI can't replace the human touch.
Not according to patients. They see AI potentially augmenting care, but empathy and compassion remain key. And both sources, the patient perspective study and the ethical review, they both stress that transparency is absolutely vital for building that trust.
Transparency about how the AI is used.
Yeah.
And maybe how it works, that whole black box problem.
Yes, the black box. The patient perspective source specifically mentioned this. It can be really hard to explain how a complex algorithm reached a particular conclusion. If AI flags your feedback or influences a decision based on your comments, patients naturally want to know why. And if you can't explain it clearly,
Trust starts to break down.
it can, yeah. And then there's privacy and data security. That must be a huge concern when analyzing potentially very personal comments.
You'd think so.
Oh, absolutely paramount. Both the ethical review and patient perspective sources highlight this. Protecting patient privacy, keeping data secure. These are non-negotiable foundations for responsible AI use in healthcare.
And patients are aware of this.
Very much so. The patient perspective study had a really telling quote from a patient worried about third parties seeing our data, like insurance companies. People want to know how their data is being used for AI. That's from the ethical review. And the patient perspective source showed they want to know who else might get access. And critically, they want some control. They want the choice to have their information removed.
That control aspect feels really important. It brings home the patient perspective on data ownership. And this is why regulations like HIPAA in the US, GDPR in Europe, they're so critical. The ethical review mentioned them.
Yes, and the HAIT book even noted India's Digital Personal Data Protection Act. It's a global concern. These regulations aren't just red tape. They're essential frameworks to protect sensitive health information, especially when AI is involved. Any responsible AI deployment has to operate squarely within these legal and ethical lines.
Okay, what about bias? Could the AI itself be biased when it's reading feedback?
That's a huge risk. Algorithmic bias. The ethical review highlights this significantly. AI systems learn from data. And if the data they learn from reflects existing biases in society.
Like maybe feedback from certain groups is underrepresented or misinterpreted?
Exactly. Or the language used by different cultural groups might be systematically misunderstood by the AI. The system could end up perpetuating or even amplifying those existing biases.
So an AI might misread feedback from certain patients or flag negative comments from one group more than another just because of its training data.
That's the danger. It's a really critical point, especially because, as the patient perspective study noted, some patients actually hoped AI might be less biased than humans.
Oh, interesting. Take out the human element.
Yeah, remove human subjectivity. But that hope only holds if the AI itself is built and trained very carefully to be equitable and inclusive. You have to actively work to mitigate bias in the AI, not accidentally bake it in.
So AI could potentially reduce bias, but only if we're incredibly careful about how we build and train it. And if something does go wrong, who's responsible? The ethical review mentioned accountability.
Accountability is key, and it's shared. The ethical review is clear. Developers who build the AI, the hospitals or clinics using it, regulatory bodies overseeing it, they all have a role. Ensuring responsible use, monitoring performance, mitigating risks, including all these ethical ones we've discussed.
Okay, so let's tie this all back specifically to sentiment analysis of patient feedback. Why are these ethical concerns, trust, privacy, bias, transparency, accountability, especially relevant here?
Well, think about it. You're dealing with people's stories about their health, often at vulnerable times. So first, protecting the anonymity of the person giving the feedback is crucial.
Absolutely.
Second, ensuring the AI doesn't misinterpret genuine concerns because of some bias in its algorithm, maybe misunderstanding slang or cultural references or just different ways of expressing frustration that's vital for getting accurate insights and being fair.
Right, you don't want the tool itself distorting the message.
And third, transparency. Being upfront with patients. Yes, we use AI to analyze feedback to help us improve. Here's generally how it works. Here's how your data is protected. Here are your rights. That builds the trust needed for patients to keep sharing honest feedback. If you mess up the ethics, you risk losing that trust, and the feedback you get becomes less valuable, maybe even misleading.
Okay, this has been a really comprehensive look. We've covered what AI sentiment analysis is, how it gives healthcare organizations specific, actionable ways to understand patient feedback better, pinpoint issues, respond faster, driving quality improvement. But we've also spent significant time on the absolutely critical ethical layer, trust, privacy, bias, transparency, accountability, drawing on what patients and ethicists are saying. So let's zoom out one last time. For you, the listener, what's the key takeaway? Why does this matter to you?
Well, fundamentally, what this all means for you is that AI-driven sentiment analysis is a tool that could help healthcare organizations listen to you more effectively. It helps them take your comments, your reviews, and understand not just what you said, but how you felt about specific parts of your experience.
So that comment you left about the nurses being great, but the billing department being a nightmare. AI can help make sure that specific feedback about billing issues actually gets seen by the right people, separate from the praise for the nurses.
Exactly. It helps route the feedback correctly, and the potential impact for you, the patient, could be quite real. Maybe a more responsive system that fixes the things that frustrate you faster.
Like shorter wait times, maybe clearer instructions.
Yeah, better allocation of resources to fix problems. Patients consistently point out waiting, communication, maybe facility issues, and maybe by addressing the root causes of confusion or dissatisfaction that pop up in feedback, like unclear discharge instructions, it could even indirectly lead to better health outcomes down the line.
Fewer complications, maybe.
Potentially. This deep dive gives you hopefully a shortcut to understanding both the power of this tech and the really important human and ethical factors involved in your own healthcare journey. It's about how your voice gets heard, amplified by tech, and potentially drives change.
So when it's done right, it can translate your individual experience into a force for system-wide improvement.
That's the goal, absolutely,
Yeah.
when implemented responsibly.
Okay, so we've explored how AI, specifically sentiment analysis, processes patient feedback to find areas for quality improvement. And we've really hammered home that this power comes with huge ethical responsibilities: privacy, transparency, fairness, tackling bias.
It's a powerful tool, no doubt, but it needs very careful, very ethical handling.
So as these AI systems get even better at understanding the nuances of our language, the emotions in our feedback, here's a final thought for you to chew on. How can healthcare systems ensure that acting on this feedback doesn't just fix operational issues like wait times, but actually helps create a healthcare experience that feels truly equitable, truly empathetic for every single patient, regardless of their background or how they share their story?
That's a vital question for the future, absolutely.
Thanks for joining us for this deep dive. We hope you have a clear sense of how AI is listening to what patients say about healthcare and what it takes for that listening to lead to genuinely better care for everyone.